All right, well, hi everyone. Ooh, I need to mute that. Sorry about that. Hi everyone, thank you so much for joining me on this lovely evening. So today we're going to be talking all about how Australia sets priority health issues, or how do we identify priority health issues. Now, I'm using a bit of a new setup compared to what I used here last time, so just bear with me if things go wrong. So if you can hear me, please let me know in the comments that all my sound is working. That'd be really good to start with. Anyone? Just tell me, just go, yep, sound's working. If it is, that'd be great. Beautiful, okay, I'm starting to see some comments coming there. All right, so that's great. I'm glad my tech is at least working for today. So yeah, we're going to be talking about how do we identify priority health issues tonight. I'm hoping to spend about 20 minutes or so on this with you, as well as talking to you a bit about what I want to encourage you to do in terms of how you study for Core 1 for your health priorities in Australia. And it might be a bit different to what other people tell you when it comes to study, but this is definitely the way that I encourage students when they're going to study this topic to approach it. So we're going to cover a couple of things tonight. So if you're ready to go, give me a thumbs up or a TU in the comments. Just let me know that you are ready for me to get stuck into this. All right. Well, let's get going then. So when it comes to how we identify our health priorities, I want to tell you that it is so much more than just epidemiology. So often what we have in our syllabus, it starts with epidemiology, and it's kind of a little bit boring, to be honest, because it's just stats. It's just, you're looking at what does epidemiology tell us? We're looking at morbidity and mortality statistics and infant mortality and those types of things. And what I want to tell you is that that's actually got very little to do, in honesty, to do with how we identify our priority health issues. What actually matters way more than the epidemiology stats is what we do with those stats. And that's what comes up in the second bit in the syllabus. So if you are looking at your syllabus, which I always encourage my students to do as you're studying, is to make sure you're looking at the syllabus. And so that second dot point of identifying priority health issues lists for us a whole bunch of stuff that we need to make sure that we're considering. And when we're looking at how priority health issues are identified, these are the main things. So those main things, right? And I'm going to say to start with the biggest thing, right? The absolutely biggest thing is social justice principles, right? That is by far and away the number one thing that determines whether or not something becomes a priority health issue in Australia. And we can actually see that currently with coronavirus being made a huge priority in Australia, where in reality, in terms of its epidemiology and its statistics, it's very minor in terms of that. So, but it's principle of social justice. This is all about protecting our needy, our people who are most vulnerable, so those who already have immunocompromised in some way, people who have asthma, or particularly our elderly people, and we're looking at protecting them with the rules and the regulations that have been coming in. And obviously, it's also an unknown virus, and so people are a bit more scared about it than they are about coronary vascular disease, for example. But social justice, when we're talking about social justice, we're talking about equity, diversity, and supportive environments. That's straight out of your prelim syllabus. And I want to encourage you to make sure you actually base your stuff on the prelim syllabus. If you want to take things a bit further here, there is also the PAIR approach, which is your participation, access, equity, and rights. Now, I want to just get a quick survey here because I've spoken to lots of teachers around the place. I want to know, are you using PAIR or are you using SEED, which is the supportive environments, equity, and diversity? So which one are you using? Just make a comment in the chat here and just tell me, are you using SEED, so supportive environments, equity, diversity from prelim, or are you using the PAIR approach, which can actually be found in some of the New South Wales government health documents that talk about social justice in health? So which one are you using at the moment? I'd love to hear. All right, yeah, so people are still using a bit of both, right? SEED, a bit of PAIR in there as well. SEED, yeah, SEED, great. So they're just simple ways of you remembering some of the social justice principles. And in honesty, you can use both of them. It doesn't matter that much. It's just really about the fact that you've considered social justice in what you're talking about. When it comes to identifying priority health issues, though, this is our key. We're looking at equity of health, right? And this is going to link for us, and I'm going to do a lot of linking as I do this, because this is going to then flow into how I talk to you about how you should study. Is, yeah, we see a lot of this following through into our groups, right? Our priority populations are actually populations that have health inequities. And so the social justice principle of a health inequity or equity, right? That's really key when it comes to identifying priority health issues. We want to make sure that people are actually getting an equity in their health statistics. And that means that, you know, some people will need more help than others, depending on their backgrounds, their socioeconomic status, all kinds of stuff. Where they live is going to impact that. Okay, diversity is another one. Yeah, and diversity is not just about our cultural background and stuff. It can include things like age. There's diversity in our ages as well, and so we need to think about this when Australia's considering whether or not something should be a health priority. It's about equity, making sure our health is the equitable health. So I'm stumbling over myself with that one. And it's about maintaining diversity and also supporting people from diverse backgrounds, and that's where access comes in too. So when you're thinking of the PAIR type acronym there, the access is part of that diversity and part of that equity. It's also part of that supportive environment. It all relates back to access there, because if it's a supportive environment, then it's about creating access as well. Diversity, having things in multiple languages, is about access and people being able to access what's going on. So I really want to encourage you, when you're thinking about how Australia identifies priority health issues, social justice is the #1 thing, right? It flows down into our group. So Aboriginal and Torres Strait Islander peoples, right? They have inequitable health, right? They have poorer health when you compare it to Australia's statistics as a whole. And so that is why they become a priority population group. And so the social justice is actually going to flow into the next dash point here, which is our priority population groups, right? And priority population groups very clearly links into our next critical question and that first dot point that talks about groups who have who are experiencing inequity in their health, right? So that priority population group is about, is this group a group that already suffers from injustice already? And if they are, then that will help to make them more of a health priority in Australia, because we live in a welfare state. We live in a country where we use the money of our wealthy to look after our poor. And it's actually about trying to build up the health of everyone, not just those who can afford it, okay, which is the American kind of system. Next on our dash points is prevalence, right? How widespread is this disease? How many people are getting it? We're looking at, is this disease really widespread? So coronary heart disease, really widespread. Skin cancer in Australia, really widespread. And so that's why they become health priorities in Australia. That links us down into our dot point around chronic diseases and stuff. And we're looking at, these are our health priorities. And then you'll learn twos that go with that. You need to have a look through those dash points. And they all link back to our social justice principles. And that's why I keep saying that this is so important, right? So prevalence, it's widespread, right? But is it widespread for everyone? It may not be, right? It may only be widespread for a particular group, right? It's a priority population group, and they're a priority population group because of inequity. And so we're looking at really looking after the people who have inequities in their health when we're looking at identifying our priority health issues across Australia. Next, of course, we need to make sure that there is a potential to do something about this. Just because there's inequity in health, or just because someone has a particular health disease, doesn't mean that we can do anything about it. There are some things around that we actually can't do much for. Okay, and so influenza, for example, actually rolls across the whole world. Every year it starts off in one place, follows the exact same kind of pattern as it goes around the world, and then comes back, and everyone kind of gets that in all the countries. And we don't have vaccines for it. We use flu shots, but it doesn't necessarily stop that new influenza that comes through. And so there's not a lot that we can do there in terms of the potential for early intervention, right? But when it comes to our chronic diseases that are particularly chronic in the elderly, so if we look at cardiovascular diseases, and we're looking at dementia, and we're looking at cancers and stuff, they're lifestyle diseases. And so there's lots that we can do to help prevent them. And that's why they're going to become priority issues for our health across Australia. Next is the cost to the individual and the community. So we need to make sure that when we're thinking about whether or not a health issue becomes a priority, we have to think about whether or not this is actually a cost to someone, right? So lots of people might break their foot, lots of people will fall over and cut their hand. They're health issues, right? They have to be dealt with, but the cost is very small, right? We put a Band-Aid on it, disinfect it, you'll be fine, you'll heal quite quickly. Or if it's a broken bone, we'll put plaster on it, you'll heal quite quickly. We don't have to do lots of campaigning around it because the cost is actually really small. But if the cost is high, so say if the cost is, death, right, that's going to be a big issue there. Or if it's really severely inhibiting people's quality of life, then it's also going to be quite high on our priority list for us to do something about it. And so it's really important, right? So we're basing everything on social justice. And I think I actually have a link on my website that I'll have to find and share with you that has my little triangle. You may have seen it. It's on, I'm pretty sure it's on the critical question for how do we identify priority health issues. There's a little triangle, and at the bottom of that is our social justice principles. And then each of these things kind of builds on it all the way up to the top. And then cost is right at the very top, because in terms of the cost, we need to also think about the cost to the government, right? The cost to individuals. And at the moment, when you think of, I'm going to talk about coronavirus, the cost at the moment of coronavirus is huge, not so much because of the disease itself, but because of all the social isolation stuff that the government has put on us. It's caused a lot of businesses to close down. It's caused a lot of us to be working in isolation. It's causing stresses on people's mental health and social health. It's putting stresses on our physical health as well. And that is a big burden that's then falling on our public, and that our government has done that. But I want to also talk about, when it comes to diabetes, the cost is quite big there too, because you have to talk about the drugs that might be needed to manage. So insulin is quite expensive to manage diabetes, but there are simple things that we can do to help prevent it, and therefore it becomes a priority because it's very costly. We can do interventions. It's quite widespread. It's hitting priority population groups especially. So, for example, the Aboriginal and Torres Strait Islanders have higher rates of diabetes compared to the statistics across Australia. And so it's really important then that becomes a priority population issue, that becomes a priority health issue across Australia. All right, now I'm going to actually swap screens here. I'm going to share my screen with you. I'm just going to flick around in the syllabus for a second here, because I want you to see a lot of links here as I look at some examples. So I talked a bit already about coronavirus and Aboriginal and Torres Strait Islanders. I'm going to talk a bit more about the elderly and just show you a whole bunch of connections in your syllabus that are just coming out of the idea of how we go about identifying our priority health issues. So if I switch over to this screen here. Okay. All right. So on this screen, hopefully, just shout out someone, let me know that they can still hear me. Yep, beautiful. All right. So this is our syllabus. So I can just zoom in here, and you can see here that these are our just priority health issues or priority population groups. As we scroll down, so here's our groups, right? And so I'm going to talk a bit more about the elderly here. You'll see on the right, the nature and extent of the health inequities is all about coming back up your syllabus and having a look at the epidemiology around the elderly and what the major things are. So what are their major chronic diseases that are affecting them? You have to use tables and health statistics. You need to consider what epidemiology can tell us about what's happening for them, but also what it doesn't tell us, because often it doesn't tell us exactly the impact on the quality of life, for example, but it will definitely tell us the impact on whether or not, the mortality statistics, for example. If we continue to scroll back down here, so still thinking about our elderly, right? We have to think about the sociocultural, socioeconomic, and environmental determinants, which are actually going to come back to your social justice principles, because your social justice principles, right, are all about considering those determinants and whether or not someone has been brought up in an inequitable state. So if they have lower socioeconomic status, that's going to be something that's going to affect them. If they're in rural and remote areas and have less access, that's a social justice issue that's being thought of here. And so when you're looking at this group of the elderly, you also need to go back up to the first critical question and think about how they became a priority health group, right? Of a group that are suffering from an inequities in health. You then have to think about the roles of individuals, communities, and governments here in addressing the elderly, right? And so that is about who is using epidemiology. So all the way up here, right? Who's actually using epidemiology and what are they using it for, right? And so we're using epidemiology to determine, right, at what extent. So is it the broad government that's doing this? Is it going to be, you know, local communities that are going to address this? Like if you're looking at rural and remote people, right, the government would provide them funding, but it's actually run by people who are in those rural and remote areas, and it's local communities. And so they're all working together in partnership to really do it, to have an effect on that social health, that inequity in health. If I scroll further down here, if I'm looking at the elderly, I also want to think, so we're thinking about the kinds of diseases that they've got, right? So they've got higher rates of cardiovascular disease, higher rates of cancer, higher rates of diabetes, higher rates of respiratory diseases, higher rates of injury, higher rates of mental health, right? They've got all of this, right? And that's part of why they're putting such a big stress on our health system. And so from down here, our growing and aging population, right? And I'm thinking of the elderly, right? One of the things that we need to do to, in terms of our early intervention, right? What can we do that's early intervention? Scrolling back up to the top here, right? Early interventions and the potential for early intervention, okay? Scrolling down, it's about healthy aging, okay? It's about helping our elderly to age well, which is all about lifestyle choices to help them to reduce the amount of chronic diseases that they're going to have, okay? And so, you know, they are the ones living with greater burdens of chronic diseases and disabilities, okay, which then puts a greater demand on our health workforce. And why do we care so much about the elderly? Well, because it's a social justice issue, okay? It's because they struggle with access, right? If they've got higher rates of chronic diseases and disabilities and stuff, they're going to struggle to have access to all the healthcare facilities. And so we provide greater support for them in that sense. It's also an equity issue in terms of all the other things here. That, if I go back to considering all the things that are involved in social justice, you know, their participation in what's going to be made as a health promotion towards them, thinking about their access, thinking about their equity in terms of how they get around, supportive environments, all that stuff needs to come together, right, in order to help them to have better health. And so you can see here, there's actually lots of connections. As you're thinking about how Australia identifies priority health populations, the best way to really think about it is to think about it in terms of examples, okay? So I'm going to switch back over to me, because I think it might be a little bit hard to watch that screen anyway when you're probably on your phones. So I want you to think about these examples, because when it comes to prioritizing, right, the big question in the syllabus is really about why is it important to prioritize, okay? So it's not just how do we prioritize, it's why is it important to do this? And that's key in any learning. You need to think about the why. And so I want you to right now in the comments, give me your #1 reason for why you think we should prioritize health. So in the comments, the #1 reason why you think we need to prioritize any kind of health issues or health groups, quickly in the comments there. Okay, thanks, Daniel. Across the government, beautiful. Healthier life, healthier, happier life. That's true, definitely, right? So that's another reason that's really good for why we should prioritize this. Reduces burdens on the community, fantastic. Thank you. Prevents deaths, to stop it from getting worse and for increasing the life expectancy, to gain the greatest benefit to the nation's health. These are all really good, right? So the #1 reasons for why we should prioritize, there's lots of reasons why we should, okay? And really for me, I think, you know, I love the fact that we are in a welfare state. And so I think that the #1 reason is all about promoting social justice and about promoting equity in health across Australia. It's really about getting the most bang for your buck for the government, right? If they're going to be splashing out billions of dollars, which is what our health budget is, right? It's billions of dollars. They need to make sure they're splashing it out in the places where it's going to have the greatest impact for providing a better quality of life for our people. And so that means finding the groups that are having the most inequity in terms of their health status and improving that group's health. That means finding the diseases that are having the greatest impact on the quality of life and doing what we can to reduce that disease across the country. And so we're looking at improving quality of life, and it's about $1 value in terms of the amount of impact, right? We're talking about the impact that comes with the money that's spent. So we prioritize to get the best impact possible, right? And the best impact for those who are most needy, I think is really a great reason there in terms of the reason for priorities. Okay, we're now going to switch over a little bit and talk about how to study Core 1 effectively. So how many of you, right, just in the comments, just say yes or no, how many of you tell your students to basically just study the syllabus and go through it dot point by dot point and study, the epidemiology dot point by itself, and then study the, prioritizing health, identifying priority health issues as its dot point by itself, and you go through like that, right? If you're a teacher, is that the way you teach your students to study? Just say yes. There's no judgment, right? There's no right or wrong. In fact, I actually encourage people to study in multiple ways. I'm going to talk about one that's probably not so obvious today. Yeah, good. So I can see people saying yes there. And if you're a student, your teachers probably has told you that, because it is, I'm going to say it is very important for you to know your syllabus, because when you get asked a question in the exam, you're going to need to reproduce the information that they're actually asking for. You can't provide information about something that's not related to the question in terms of the content the question wants. However, when you're studying, the way that your brain works is that your brain likes to bring things together and cluster it. Okay, so if things are related to each other, if you can bring that all together, it will help you to remember it, right? And I can also tell you that your syllabus requires you to, and in your HSC exam, you're required to provide examples. And so I'm going to really encourage you to study the examples across the content. Okay, and so what I mean by that is, just like I showed you then when I was talking about the elderly and how that actually links in to pretty much the entire Core 1 syllabus, right? It's going to cover every single dot point. If you do a really good study of the elderly in terms of what their chronic diseases are, the statistics around that, what's happening in terms of the nature and extent of that disease, why they were identified as a priority population group, why the diseases and the chronic illnesses that they have been identified as priority health issues. Why has that all happened? Well, that requires you to go back to that first critical question and how we identify priority health issues. Okay, we then look at the elderly as a group. We look at the diseases that they've got, which is the next dot point on chronic health illnesses and stuff. We then have a look at our growing and aging population, and then their impact on our health services. And you're starting to look at our health services, okay, that are in the syllabus, and the importance of the government and communities and individuals all working in partnership. We're talking about why Medicare is good for the elderly who are particularly disadvantaged in terms of money, but how having private health insurance will really benefit those who can afford it, because it means they'll get into getting their knee reconstruction if they need it. They'll get into that faster. And so it becomes really important that comes through. And so if you study your examples, right, it'll allow you to bring pretty much the whole syllabus together and see the point of it all. Okay, if you focus on Aboriginal and Torres Strait Islanders, you can do that across the whole lot as well. The elderly, you can do that across everything. You can do cardiovascular disease across everything, because cardiovascular disease is particularly prevalent in those groups that are particularly high in terms of our priority population groups. And so this connection that is through the syllabus is found in the examples. And so if you study an example really well, it will help you when you're asked the questions, because you've got your example ready to answer that question. And you should have multiple examples, because you're going to have to do Aboriginal and Torres Strait Islanders and one other group. You're going to have to do cardiovascular disease. You're going to have to do cancer and one other chronic disease or illness. And so if you study the whole syllabus through those lenses, right, then when you come even to the Ottawa Charter and in action and how we're looking at health promotion across Australia, you can just identify these health promotions that are targeted at your groups that you're looking at, or that are targeted at those diseases that you've been looking at, and it brings it together for you. And so you're focused, and you're going to study the elderly really well. You're going to remember it because you know the elderly, right? You're clustering this stuff together, which helps you to remember it later. Okay, that is not to do that in neglect of making sure you know the syllabus and how it flows, but it's to in addition to, so that you're studying and connecting this content, so that you're really building that out. And I would encourage you. I've been doing a lot of research into project-based learning lately, and across my school at the moment, we're doing a project-based learning unit for Core 1, and it's doing a very similar thing where we're looking at a disease at the moment and how it goes across multiple aspects of this syllabus to bring it together. And I would encourage you, if you're a teacher, to think about how you might structure Core 1, so that you might actually have the students to look at these groups, to look at these chronic diseases across the entire lot of dot points, and see how you can actually bring this syllabus together for them, as well as making sure that they learn how the syllabus is laid out, ready for their HSC exam questions. Okay, so the next thing I want to talk to you about is, before we go, so I want you to select one example, right? So there's a whole bunch of them. There's the primary population groups, there's the chronic diseases and illnesses. I want you to select one. I want you to write it in the comments right now, okay? Pick one group that you are going to use for your focus to study in the next couple of weeks around Core 1, right? Just to help you to really bring the syllabus together, this one example that you're going to focus on to do that for you. And even if you only do it once for one and then you break it all apart and do it all separately, differently, that's okay. But you just want you to do it for one to help you to bring this whole lot of content together. Okay, so I do teach at a school, definitely do. I teach at Cedar College. All right. So rural and remote is in there, great. See, Aboriginal and Torres Strait Islanders, that's really good. Lots of people saying that. And I would, particularly for me as a teacher, I think we need to teach Aboriginal and Torres Strait Islanders. That's one of those mandatory ones. I would, as a teacher, model Aboriginal and Torres Strait Islanders to the students, and then get them to do the other one across the thing themselves with some scaffolding. And then maybe when you move on to chronic diseases, you could remove some more scaffolding to get them to have a look at cardiovascular disease, or maybe you'll model cancer for them or something, just to help them to work out how to bring this all together and making sure that they're ticking off syllabus as they're looking at this kind of content as well. All right. So that's pretty much it for tonight. I want to remind you that my next Facebook Live is tomorrow at 12 p.m. Now, I'm doing it during the day basically because I know a lot of students at the moment and a lot of schools are doing remote learning. And so if you're around at 12 o'clock, it should be close to your lunchtime, hopefully. Please jump on here and watch the next one. I'm going to be sharing my 3 study tips, my 3 top study tips even, for you just in general, that will help you not just with PDH, it'll actually help you with everything that you study at school. And if you're a teacher, come along to that as well. I'll be happy to share that kind of stuff with you. If you enjoyed this Facebook Live, I would love for you to just quickly leave a short review on Facebook for me so that other people know that what I'm doing is actually useful and helpful for you guys. And then finally, if you don't know, it's all over my site at the moment, I'm pretty sure, but I'm running 2 HSC study days this term. I would love to help you or you as a student, or if you're a teacher, your students out. Please make sure that you register this week. It'd be really good. The first one is on Thursday, the 26th of May. The second is on Friday, the 28th of June. But the booking for the 26th of May is actually going to close next week. And so I want to encourage you, if you have been thinking about coming or you want to come to that, it's all online. So it's going to be done online like this. So it doesn't matter if your students are remote or if they're at school in the classroom, they can all join. So you can sign them up as a whole class, or if you're a student and you want to come, you can sign yourself up and come along to either of these 2 days. They are exactly the same in terms of the content I present, so don't sign up for both of them. You only need to come to one. I've chosen to do two, one on Thursday and one on Friday, because last year when I ran it, I had a whole bunch of people ask if I was going to run one on another day because it clashed with an athletics carnival or something like that. So please come along. I would love to continue to share stuff with you. And you know, if you can't make it to that, at least make sure that you get along tomorrow at 12 o'clock. You'll see the post underneath this one on the page in Facebook, but I'll pin it up the top and I'll put it onto my website as well, where this pin was previously. And I would love to see you tomorrow. Thank you guys so much for coming along. Yeah, if you have any questions, feel free to chuck them into the comments right now, and I'll see how I go.